Hier, nous avons eu l'opportunité de bien comprendre les efforts d'autres pays africains pour développer le système de traçabilité. En fait, tous les intervenants ont parlé du challenge de produits falsifiés et nous partageons les efforts pour les résoudre. Nous avons commencé par Nigeria, Nigeria nous a partagé leurs progrès. Digimoji, elle nous a partagé sur le projet de pilote et leurs efforts d'engager les parties prenantes depuis vers 2018. Ce projet de pilote était possible grâce aux identifications uniques de produits en utilisant le GT1, le GT1, pour identifier uniquement le produit. Et ces engagements ont donné les parties prenantes une opportunité de bien comprendre les raisons d'implémenter ou d'adopter la traçabilité au Nigeria, en utilisant les normes GS1, effectivement. Digimoji nous a donné quelques conseils. Je vais essayer de rappeler, d'utiliser ces mots. Elle a dit que c'est important de commencer où nous sommes et avec des ressources qu'on a maintenant. Ça veut dire un pas à la fois. Elle a aussi souligné l'importance des autorités nationales de réglementation de continuer à vous engager pour apprendre et de partager vos expériences entre vous. Ensuite, le Bénin nous a partagé sur leur projet de e-pharmacie. Ce projet va donner au pays une opportunité de tracer les médicaments au niveau local. Il nous a partagé l'importance du catalogue national de produits, Master Data Catalogue. L'idée est de bien définir les produits qu'on va tracer, qu'ils vont tracer dans leur système, parce que nous ne pouvons pas tracer ce qu'on ne veut pas. Donc, c'est l'essentiel d'avoir le catalogue national de produits. Ils nous ont aussi mentionné leur effort d'avoir l'interopérabilité entre les systèmes qui ont utilisé au domaine de la santé. Par exemple, c'est utilisé pour gestion de stock de médicaments chez le centre d'achat. Puis, il nous a partagé qu'ils sont en train de faire une revue réglementaire pour bien supporter leur projet. Ça veut dire que après l'approbation de ces réglementaires, tous les produits seront identifiés en conformant les normes GS1. Ils ont aussi souligné l'importance d'engagement avec les parties prenantes. Donc, c'est aussi le message clé partagé aussi par Pénin. Ensuite, la Burundi nous a partagé qu'ils sont en train de finaliser leur stratégie et une feuille de route pour mise en place leur système de traçabilité. Et cette stratégie sera signée par le ministère de la Santé, je pense, dans le prochain 2 ou 3 mois. Pour eux, le point clé qu'ils ont partagé hier était leur engagement avec les différents acteurs au niveau national dans cette étape fondamentale de créer ou développer une stratégie nationale. De la part de Rwanda, il nous a partagé un bref sommaire de leur effort de définir les réglementations pour leur système de traçabilité. La réglementation a été publiée l'année dernière. 3 points clés partagés par Rwanda. La première, c'est l'engagement des parties prenantes. La deuxième, c'est l'importance d'avoir les réglementations. Et finalement, ils ont aussi souligné l'importance d'avoir de l'interopérabilité entre les systèmes. Au côté du Togo, ils ont partagé qu'ils sont en train de prendre la première étape pour avancer leurs efforts de mise en place du système de traçabilité. Cela est une étape importante qui donne l'autorité une opportunité de mieux comprendre la situation actuelle et mieux définir les besoins, les opportunités et les défis aussi. Après le pays, Sophie de GS1 Global Office nous a partagé quelques conseils pour définir vos engagements avec les offreurs de solutions, les solution providers. Selon Sophie, il y avait 2 messages clés. GS1 n'est pas une offre de solution, et aussi, plus important, que nous sommes là pour vous donner la conseil. Donc, n'hésitez pas à nous contacter. Pour conclure, Rami, pour conclure le jour hier, Rami de USAID nous a donné une introduction de l'objectif clé du sommet, qui était transformation numérique de la chaîne d'approvisionnement. Donc, nous allons commencer par la deuxième partie de cette présentation. Pendant les 3 heures d'aujourd'hui, nous allons parler de ce sujet en plus. Dans la diapo suivante, Angela, s'il vous plaît, nous allons, vous pouvez avoir le détail pour la deuxième journée. Et donc, nous allons entendre d'autres pays africains qui ont commencé la mise en place de systèmes de traçabilité, notamment la Zambie, l'Éthiopie et l'Afrique du Sud. Et en plus, nous allons entendre de pays qui ont avancé leur système de traçabilité, notamment la Turquie, l'Argentine et aussi l'Inde. Nous vous rappelons de soit toujours engagé en utilisant la fonctionnalité de chat, de Q&A, de chat. Donc, si vous avez des avis de partager, vous pouvez, nous vous invitons d'utiliser la fonctionnalité de chat. Et si vous avez des questions, vous pouvez aussi utiliser la fonctionnalité de Q&A qui est déjà là sur Zoom. Et aussi, je veux mentionner qu'aujourd'hui, nous aurons les intervenants en 3 langues. L'intervenant d'Argentine va parler en espagnol. Donc, aussi, nous aurons l'opportunité d'utiliser la fonctionnalité Zoom pour changer les langues. Donc, je vous invite à regarder ces fonctionnalités maintenant. Et pour finaliser, je vous invite à noter vos suggestions, recommandations pour bien collaborer et échanger des expériences un peu plus d'une fois par an pendant ces sommets. Nous aurons une discussion avant la clôture de ces sommets et nous apprécions de recevoir vos suggestions. Donc, avec ça, je veux inviter, pour les interpréteurs, maintenant, nous allons changer au anglais. Et donc, at this point, I would like to invite our colleagues from WHO to present on the second part of the digital supply chain transformation piece. So we have Carl and Swaroop joining us from WHO. Please take the floor.
Hi, everybody, and thank you once again for this opportunity to share with you some of the work that WHO is doing. But before getting into that, I'd like to just maybe reflect a little bit on the recap from today that was just shared and where we're going. Yesterday, we heard from a number of countries progress that's been made over the last few years as they work towards improving supply chain information systems around governance, around product master data, and work towards traceability, successes and challenges throughout. And as we speak towards today and looking around digital transformation, we can think about digital transformation as being guided by a strategy or vision of what we want to achieve. And there's certainly a very important component around the transformation of a supply chain into a digital supply chain, but there's also a view in mind of how that supply chain information may be used in a larger ecosystem and a larger enterprise. And with that, I wanted to share some of the work that WHO is doing around smart guidelines, which looks at public health and clinical health uses and guidance and their connections with product master data and supply chain information systems. And so that as you think through your digital transformation efforts, you can also have in mind some of these activities that are ongoing and being taken up by some of your colleagues and on the public health systems or clinical health sides. So with that, maybe we can get started. And So first of all, just a little bit about the work that we're doing at WHO is guided by our global strategy on digital health. This is a document that was produced and ratified by member states in the World Health Assembly and guides our body of work over the next 5 years, and WHO serves as secretariat for that work. There's actions that are called out for WHO as well as member states, but among these actions, there are some important key themes and messages that align with what we talked about yesterday around interoperability. Looking at defining national digital health architectures, blueprints and roadmaps that adopt open source digital health standards, reusable system assets, and to make sure that as much as possible, different digital technologies are using shared services so that and ensuring that data are of good and comparable quality across various systems. There's also a strong emphasis on interoperability, both syntactic and semantic standards. So the semantic standards would be the things that we're talking about, such as the product master data. But this applies not just to supply chain system, but all types of approaches to digital transformation that countries are taking up. Next slide, please. So one of the things that WHO is doing is looking at the development of smart guidelines. We're taking traditional PDF or paper-based guidelines that WHO has published and trying to make that easy or to digitize. Currently, if we look at the steps of taking a WHO guideline and getting it into a digital system, there's multiple steps. The first step is once WHO produces that guideline, the ministry will adapt that to their local context. Then if we're looking at digital tools, so a contract with technology partners to translate those national policies into digital solutions, which are then made available to the health workforce and health service users. If you look at the sort of the steps involved in the guideline development, there's subject matter experts, scientists that come together. But when we get down to the technology partners, we're already a couple steps removed, and they don't have questions, the opportunity to ask questions and clarifications of the narrative guidance authors who aren't necessarily thinking with digital solutions in mind, and it can be very difficult to interpret what a particular recommendation means into a digital system. So we really want to make sure that as we go through this process, that we can ease some of that pain point, offer better opportunities to understand where a recommendation comes from, and really get into digital assets that can be used in systems and reduce the burden of translation of narrative text content into digital solutions that are currently being taken by every country. Next slide. So as we go through the smart guidelines approach, we have a very structured process, beginning with those narrative guidance. The next step, which is the L2, it's our operational side. This is essentially the business requirements where we have digital adaptation kits that bring together user stories, data dictionaries, business processes. It's really where a business analyst would come in, work with the subject matter experts that produce the narrative guidance that really document in a much more formal set of requirements that can be turned over into to a vendor to produce a particular tool and ensure that there's consistent understanding of how guidance should be interpreted and implemented in those digital tools. The next layer is the machine readable layer, the L3, and that's where we get into computable assets. These are taking the business requirements in the L2 layer and really developing things that can be directly loaded into executable software, which is the final layer, L4. In the machine readable components, this is where the interoperability standards really come into play from the syntactic side, and we're looking at, in particular, HL7 FHIR as a standard for clinical systems, for public health systems, and we definitely need to think through what that intersection is with GS1 when we look in the supply chain. There's decision support services, indicator calculations that we can do at the machine readable side, and we'll see some examples of what that looks like. On the semantic interoperability standards, those are represented in the L2 for the clinical systems with things like the International Classification of Diseases, ICD, or LOINC. From the supply chain side, this is where the product master data comes in as the basis for semantic interoperability. Finally, at the L4, those are the actual tools that are being developed and deployed into countries. WHO is taking responsibility for the L1 to L3, so that when we get into that final step into the country implementations, there are a lot more assets and tools and guidance on how to implement those digital health tools. Next. Here you can see a status slide of some of the areas that we're working in. This slide is never up to date. There's always more that's going on, but you can see here that we have antenatal care, family planning, HIV, STIs, immunizations, care in emergency settings, TB, etc. So we've got our aim is to cover all of primary healthcare for clinical settings, as well as in the public health, so priority to look at integrated disease surveillance and response, which isn't necessarily reflected on the slide. Next slide. Here, just to go through the various layers, just to give you some concrete examples. This is the L1, the narrative document. So this is extracted from a WHO publication, looking at guidance around iron and folic acid supplements. So for antenatal care. So you can see here that we already are connecting with product and supply chain in the clinical setting, and how we really need to think through how we bring these things together. Next. Here you can see an example from the L2, the business requirements, where we document a typical A&C consultation workflow from registration and discharge or referral. And you can see highlighted in red, we have a touch point with supply chain where we're conducting lab tests and imaging. We also have dispensing events that may happen, or referrals to a pharmacy, et cetera, immunizations that do also touch on supply chain. And next. We also see in the L2 indicators, programmatic indicators for various needs that are taken directly from the L1, the narrative content. But here you see an example of an indicator that has implications on supply chain, which is looking at essentially the dispensing events for iron or folic acid supplements. And so if we had better supply chain information systems connected to the clinical information systems, we could automatically calculate some of these indicators rather than having to do this by hand. Next slide. And here you can see an example of the computable assets, the L3 assets, which is really something that's consumable by digital health tools. This represents the same recommendations that we saw previously. Next. And so now I just want to turn to sort of some examples of how some of the digital health, digital transformation that could happen, looking at Malawi's supply chain systems architecture. Here we see a particular challenge related to increased workload due to the need to manually report data systems. So connecting back, how do we reduce that burden around stockouts and data entry processes? Next. In general, as we think through digital supply chain or digital health architecture more generally, we want to establish who are the stakeholders, what their primary needs are, and their interactions. So you can see this table on the right sort of captures at the high level some of the various needs and stakeholders. Next. Based on an analysis of those needs, we can then produce a draft architecture that we can use to help design and build a roadmap for future investments in our health information systems. You can see here some of the foundational components in the bottom right of that diagram includes a product registry, health facility registries, supplier registries, some of the stuff that we had discussed yesterday. And so I really want to think, how do we bring through all these things together at a national level? Next, looking at the global level and what WHO has in terms of product master data or product master like data, there are a number of different catalogs and list of medicines and devices that WHO manages for various use cases. Here, for example, is the model list of essential medicines that are considered important for primary care. And what we want to do is make sure that we can bring this information and connect it with the SMART guidelines as well as the implementations in country. Next. Another set of examples on priority medical devices for reproductive, maternal, newborn child health, as well as medical devices for the COVID-19 response. So there's some use case specific catalogs or lists, and currently those are generally in PDF or paper format and not particularly computable and accessible. We really want to make sure that we can, as we look through these things like a priority medical devices, are we able to ensure that we have those in the health facilities so we can provide appropriate care. Next. Next, I just want to turn it over to Swaroop.
Thank you, Carl. Hello, everyone. I'm Swaroop Jayaprakash. I'm a digital supply chain consultant with WHO. I just wanted to piggyback on what Carl mentioned and mention some of the activities that we're doing, mainly related to digitized product catalogs and how it links to the SMART guidelines. But before that, I wanted to highlight again the importance of product master data. This was emphasized several times in yesterday's presentations, and also Rami mentioned towards the end of his presentation the importance of having a good foundation when you begin the digital transformation, digital supply chain transformation journey. But really, the product master data is at the intersection of digital health and digital supply chain, because for services you need medicines, but at the same time on the supply chain side you need to make sure those medicines are delivered to customers or patients. So product master data, this is really the data that helps identify products. So this is just a summary of what the product master data includes. Next slide. As part of the SMART guidelines effort, we'll be looking at open source product catalog management tool and see how we can integrate that with some of the things that Carl mentioned, and how countries could take advantage of the resources. But one thing I wanted to highlight in terms of product catalog management tool is this is an open source tool. It was developed when RHSC was looking for a product master data management tool for global family planning WAN, and it is aligned quite a lot with what GS1 prescribes in terms of standardizing product master data. And it also has the capability to link and map with country identifiers so that there's minimal disruption to supply chain operations. Next slide. As you can see from this visual here, there are several supply chain partners, and also there are several supply chain systems, including digital or digital health systems, and each typically have their own way of identifying products. This was also highlighted in several presentations yesterday, including Benin and others, that they're having this challenge of product master data harmonization because different systems identify products differently. So this is really the problem that we are trying to address. And this very much sits within the SMART guidelines objectives as well. Next slide. So with a tool like the open source product catalog management tool, the objective is to harmonize product master data in a way that all supply chain partners, not only global, but also at the country level, can identify products the same way. But at the same time, it's aligned with standards like HL7 Fire, and it can be used in digital health systems and tools. But at the same time, it can also be aligned with global standards like GS1. So we can take advantage of some of these standardized identifiers and attributes that are already in place and in use by manufacturers. Next slide. So as part of the SMART guidelines initiative, given that product master data is really at the intersection of digital health and digital supply chain, and the importance of product master data, and also to provide resources to countries to address this challenge around product data harmonization. Under this effort, we will be enhancing, doing some feature development and hosting PCMT that will support country adaptation workflows as part of the SMART guidelines. And as part of that effort, we'll be looking at how we can synchronize and align with HL7 Fire terminology services as well. And we'll also be looking at existing resources like Global Product Catalog that was done in 2021, 2022, and also RHSC's Family Planning Catalog, and so that we can build on those resources and not have to start from scratch. And also some of the things that Carl mentioned in terms of essential medicines list and medical devices list. So we'll utilize those to build product catalogs. And we're also planning to develop an implementation handbook, which talks about how to implement standardized national product catalogs. It is part of a larger or a broader handbook that talks about digital supply chain architectural approaches in general, but it will be kind of combined into that handbook and link how national product catalog or product master data management is a foundational and key aspect within the digital supply chain effort. So that's it from us. Over to you, Angela.
Thank you, Swaroop. Thank you, Carl, for those presentations. So please, if you have any questions, please put them in the chat, and we will get to them later. In the meantime, Pete, you're welcome to start sharing your slides and take the platform. While you are sharing your slides, I would like to mention briefly to the participants that are asking for the slides and the recordings, we will share all that information to your inboxes over the next 2 or so days once we finish the summit. Thank you. Pete, over to you.
Thank you, Nuran. It's a pleasure to be with you today. And over the next 15 minutes or so, I would like to talk with you about the role that GS1 standards play in this digital transformation. And so as I sat and thought about where to start this discussion, I thought it'd be appropriate to start here. And this is the 50th anniversary, as you probably would have heard in many of our conferences, of the first scan of the UPC barcode. And I thought this is an interesting place to start to talk about where we're going to go from here in the digital transformation. At 9:05 a.m. on the 26th of June, 1973 in Troy, Ohio, this lady behind the counter scanned the very first UPC barcode. And what we didn't know then is that for the intents and purposes of GS1 standards, this was the beginning of the digital transformation. Now, we didn't call it that. I mean, the gentleman, the engineer that installed the first scanner was the gentleman that hired me when I worked for the Uniform Code Council, and now GS1 US. And what we didn't know is that thing that we called the UPC number, which you know as the EN13 number that you see when you go to the grocery store, you buy a pack of mints or something else. was the birth of the global trade item number. Now, in all honesty, we didn't call it the global trade item number until years later, but that was the beginning of all of that. And if you want to know more about the trials and tribulations and what it took to get from the concept of scanning black bars and white spaces to the first scan, this book, The Revolution of the Check and Counter by Stephen Brown, who was the first legal counsel of the Uniform Code Council, a gentleman I had the pleasure of working with. That book explains how it all worked, and it's an amusing read. So if you're looking to know more and you want a good history and a good story to tell at a party, read that book. But more practically, I remember the first time that I went to a doctor's office and there was a computer on their desk, and much like this little girl there, I was looking at it in amazement, like, why is there a computer here? But that's not where we start, right? If we leapfrog to where we are today and we hear about all the phenomenal things that are planned in the digital space and all part of the digital transformation, we hear, for example, what Amazon is planning. They're changing healthcare by setting up initiatives to transform the pharmacy, the medical supplies, and insurance, and you can read the rest. The part that I thought was interesting here is this part about telehealth. And as we all learned in January of 2020, most doctors, including my own, if I called them and asked them about telehealth, there probably would have been a pause and a question, but what do you mean? But later that year, we learned that most doctors in most parts of the planet had to have some type of telehealth capability. And so it'll be interesting to see where this goes with Amazon. Secondly, Apple Healthcare, Tim Cook was quoted as saying this, which is really interesting, knowing the role that the iPhone has played in transforming how we all communicate with each other and interact, that in the future, their greatest contribution will be contribution to mankind. So it'll be interesting to see where Apple goes with their healthcare initiatives. Google, well, Alphabet, the parent company, focuses on the expertise of artificial intelligence, which is double-edged sword and something we hear a lot about. But it'll be interesting to see the role that artificial intelligence plays in the future around digital health and digital transformation. Then lastly, Microsoft is focusing on the cloud market. And so if you're like me, when you go to the doctor and all of the records are on paper, it'll be interesting to see what companies like Microsoft and others will do around cloud-based records and things of that nature. But the question really becomes, where do we go from here? Because this is not what we're here to talk about today, precisely, right? It'll be years until most of us will be able to benefit from something like this and the good efforts of all of these companies. But it'll be a while before we can all see this. And as I deal that Carl and Swaroop went before me, because one of the things I thought that I wanted to mention right up front is this smart guideline from WHO. I read it, and if you haven't, I would encourage reading, particularly after listening to Carl and Swaroop. It is very interesting and it's informative, and I learned a few things. On the landing page, they have a statement which I think is extremely powerful, and they say digital technologies are now integral to daily life, and it is. I have one, and I'm sure you have a phone, and this is how we communicate with each other, right? Look at how we're doing this today over the web. And the world's population has never been more interconnected. They go on to say that despite this, the potential of digital technologies and innovation to improve health populations remains largely untapped. And that is such a foundational and important statement to make. And so I thought that's a good place to start. So the question becomes this: where do we go from here? So I want to start this. I want to start here with what's going to follow in the next few slides. And let me tell you who Dr. Bill Hargrave is. He is the president of the University of Memphis. The University of Memphis, by the way, is the university where we have our AIDC lab. So whenever we go about considering changes to barcoding specifications, and so those of you that are very close to GS1 standards, you know something called the GS1 general specifications. That's all the specs are for all the barcodes. Whenever we contemplate changing something we have a lab that's staffed by the professors and the graduate students where we test how far we can push barcoding specs to do more faster. But to come back to the point at hand, Dr. Hargrave, in a discussion recently about the digital transformation, was quoted as saying this, asking this question. He said, the discussion was, his opinion about digital transformation, and supposedly his first remark was, what must stay the same so that the rest can change? So let me read that again. What must stay the same so that the rest can change? This is extremely important for us, because as we listen to what Carl and Swaroop told us about the work that they're doing, and we think about the digital transformation, then the question becomes this: if we need to move from the space of where we are today and how things function today, and especially in areas where the global trade item number is scanned, the G10 is scanned, and GLNs are used, to that new space where technology plays a much larger role in the delivery of medical care, in the development of products, and in medical products themselves, then what must stay the same? Here are my thoughts on what must stay the same, and it'll come right back to underscore something Swaroop just said. Digitization of the healthcare supply chain requires interoperability. If we don't have interoperability, it's impossible to get digitization to work. So let me draw an analogy. Mobile phones. What remained the same when mobile phones came out was the phone number. Now, obviously, the phone number today plays a significantly different role than it did 20 years ago when we pick up a phone and dial. If you're my age, you have the rotary dials. But the important point is that what remained the same there is the phone number. That enabled the interoperability at the start of that particular digitization. For us, I'll tell you in a minute what those two parts are. Interoperability requires harmonization. So if we're going to interact in a new way, in a digital way, then we have to agree at a minimal level what the language we're going to use with each other that's going to remain the same, that we're harmonized so that we can take that step and leapfrog. Harmonization requires identification of the what and the who. The what is what are we talking about, and the who is who are we dealing with. And so to put it in more practical terms, is what Swaroop said. It's the global trade item number is the answer to the what. What is this thing, this COVID test kit that has the data matrix barcode in the back, has the G10. This is the what. So no matter what system scans this, whether it's a handheld scanner at the local pharmacy where I bought it, or a more advanced system somewhere else, if it's another product, it's the G10 that remains the same, the transformation. Now, that answers the what. The who is, if I'm your provider, if I'm your healthcare provider or your manufacturer, the GLN answers that question. Who am I and who are you? So that we can create that electronic record that will go through the visual that Swaroop showed us a minute ago. And so if you're familiar with GS1 standards, you know this, that the GS1 system consists of 3 different areas: identifiers, the ways to capture that information, and ways to share it. So identifiers, particularly what we're talking about today, are the GLN and the G10, and there are others, but we won't go into all of that today. And the question is then, are all of these things required to start or progress to digital transformation? Well, not all of them are required, but some are foundational. The capture of the barcodes and the RFID tags, and then the share is the Global Data Synchronization Network, EPCIS and XML and ENCOM and these kind of things. But not all of them are required to answer the question that Dr. Hargrave asked us, which is what must remain the same. In my view, in my opinion, here's what needs to remain the same in that transformation. The G10, the GLN, the G10 will identify, as I said, the product, and then there may be more on the barcode. For instance, the data matrix that I showed you has an expiration date and a lot number on it for traceability purposes, for example. So the G10 is foundational to that record that's going to be shared across all of those different systems in many different technological ways. The who is who is the provider, who's the supplier, who's the manufacturer, who's the distributor, you get it, right? That identifies the who. Those are the two connecting pieces that allow us to then share that record, whether it's a record about a product or a traceability, whatever it is. These two things, these two keys connect the pieces of the puzzle together. The next piece of the puzzle is this, is the master data. And so master data, you heard about the National Product Catalog and what Carl and Sarup were talking about. And so the master data, the foundation of the master data, what makes master data work, is the G10 and the GLN. The G10 identifies what the record is all about, what product the record is about, and the GLN identifies who provides the product and who is intended to be shipped to, if it's a shipment, for example. The integration becomes extremely important because the integration is what creates the interoperability if it's done correctly. And so the role of the G10 and GLN and a master data record integrated becomes the G10 plus the GLN plus the master data. That enables the digital transformation, in my view, because of the following, because no matter what the digital transformation is, if you remember what I said a little while ago about Amazon and Apple and Google and the rest of these companies, then in that world, what will enable us to move from where we are today to where we wish to be years from now are these two keys. And so that's the bit about the role of GS1 standards. Now, before I turn it back to Nuran and company, one more thing. So the one additional thing I was asked to talk about is this. There's a lot of discussion going on about this migration from paper to digital. And what we mean by that is the leaflets. And if you open the pack, whatever pack it is, and you pull out the paper leaflet that we all maybe read or toss aside sometimes, it's all about this. And so in that digital transformation from the paper leaflets to the e-pill, as it's called on the pharmaceutical side, or the EIFU, it's instructions for use, then there's a role that GS1 standards play. And by the way, there is an environmental opportunity in that transformation from paper to digital. You might imagine what that is. But in that link, when you get the slides, that link will take you to that paper if you wish to read more about the sustainability aspect of this. I'm going to hit play on this video so you can see what's happening, but I'm going to explain what's happening. This is a slide that Johnson & Johnson shared at a recent conference. And so they used the digital link standard, which is a standard we developed a few years ago, to scan the existing barcode. They scan their data matrix barcode on their pack, and an app on a mobile device scanned the barcode, connected it to their paper leaflet, their digital leaflet online. But they want to demonstrate one more thing. They want to demonstrate interoperability. So you'll see them scan a barcode from Bayer in a minute. There it is. And access a leaflet on a Bayer product. So what happened here is this. The G10 of the product, both the J&J product and the Bayer product, were scanned with a mobile phone and an app that has the ability to connect that G10. There's no URL on the barcode. That G10 to the digital information about it online. And J&J did it for a pilot in Singapore, but this demonstration was something they did recently, and I wanted just to share that with you about the digital link standard. And so we'll provide more information about the links and more information that you can read after the event. So Nuran, that's me. Thank you to everyone. I hope that was helpful, and don't know if there are any questions, but I will turn it over back to you then. Thank you so much.
Wonderful. Thank you so much, Pete. You're a lovely storyteller. Hearing that. Yes. So for those participants, as always, if you have any questions, I know this was a lot that was already shared. Please put your questions in the chat, and we will try and respond to them over the course of the day or follow up with you on email. So now we continue with our tour du monde, and this time I hand over to my colleague Da, who will be the pilot as we take a little bit more steps to look at how other countries in Africa are doing on this traceability journey. Da, the platform is yours.
Thank you very much, Noran. Merci beaucoup et merci aux présentateurs qui ont commencé avant moi. Donc, nous allons continuer toujours cette journée avec un panel qui va discuter sur les approches de traçabilité liées au GS1, surtout dans le cadre du design, de l'architecture, des concepts et de la méthodologie. Donc, juste pour rappeler rapidement l'importance de GS1, qui touche plusieurs niveaux de la chaîne d'approvisionnement, en commençant par les fabricants qui, avec le système, vont améliorer beaucoup leur gestion des inventaires et aussi la satisfaction de leurs clients au niveau du système de réglementation qui va aussi améliorer la visibilité et toutes les politiques de prise de décision qui seront basées sur des données qui sont de qualité, les fournisseurs de soins qui va améliorer la sécurité des patients et l'efficiency aussi, surtout au niveau opérationnel. Et le tout va bénéficier aux patients qui auront des produits de qualité. Donc, sans plus tarder, nous allons commencer avec l'expérience de l'Éthiopie dans ce domaine et nous allons commencer avec Dr. Heran Gerba, qui est la directrice générale de Ethiopian Food and Drug Authority. Over to you, Heran. Elle est accompagnée dans cette présentation avec aussi avec Al Chifra. Over to you, the Ethiopia team.
Thank you very much. Al will present for Ethiopia.
All right, thank you, Dr. Da, as well as Heran. So I will be doing the presentation as Heran, our Director General for the Ethiopian Food and Drug Administration just mentioned, and should be joining us on the panel discussion as well. So next slide, please. Great. So looking at just the strategies that we set out to go. So a lot of times, the focus has been more on from the supply chain, from the central medical stores and down. But in Ethiopia, we realized that there's a lot of this work really had to begin at the regulatory level. So we believe that this work will help strengthen the regulatory system. And the other piece in terms of objectives is the capacity of stakeholders, which is wide-reaching, not just necessarily limited to the health sector, which I'll touch further on. Then strengthening knowledge and communication collaboration, as well as visibility to the supply chain from the very beginning at the top on the upstream level, as well as all the way to the bottom, which is the last line, improving patient safety and efficiency for the whole supply chain. Next slide, please. So as we discussed, working on this slide, we had a number of discussions and we filtered it down to these 4 points that we would like to share with the community here, looking at what Ethiopia did over the last 6-7 years. So the first one is, let me go over the key points and then I would go in detail. So the first one is communication, the legal frameworks, digitization, and enforcement. And on this presentation, we really like to share the lived experience that Ethiopia has had in having an early start and then also having some of the process as well as the challenges. So one of the really effective things that was done at the beginning is do a lot of communication. When we did it, we almost probably didn't understand how important it was in terms of how it was going to help down the road. But a huge amount of socialization needed to be done, both at the top level, but as well as the different stakeholders, the central medical stores, facilities, the suppliers, manufacturers. So we went through a very long and extended process in getting everybody to understand what traceability meant, what verifications were, what track and trace was, and so on. All these keywords and vocabularies were not something that were local to anyone. And I'm sure this is true for all different countries. So getting the concept understood at a much deeper level, getting the keywords and what it means, what they don't mean, understood again by different stakeholders who later come make decisions when we go back to them was the most effective work that we've done, and that was crucial. So, and happy to say that, you know, early on we had a lot of support from GS1 as well as top leaderships in Ethiopia, starting with the Minister of Health, who took on this communication work and help us sensitize the entire community. And the next most important thing was the legal framework. A lot of this stuff cannot be done just on a vacuum, just because somebody believes or a number of officials believe that it's important. It's just not going to work. So to this end, the Ethiopian Food and Drug Administration did a great deal of work getting the legal framework come in place. This was not as simple as writing a couple documents. It was a very extended process, again, building on the communication that was done prior, involving led by the Ethiopian Food and Drug Administration, but also the different stakeholders on the supply chain side, the ministry side, Minister of Justice, the customs agencies, and so on, had to get involved, had to get consulted in order to be able to push this legal framework forward. Also, a great deal of advice and support from different stakeholders, including GS1, was critical in helping establish this. So going with communication as well as legal framework, what's next, right? So a lot of times when we talk about track and trace or traceability, there's this huge assumption that a lot of the work, I think Nuran described this earlier, saying that GS1 is not a solution, but basically a means to help you get there. So what that means is you already have to have your own building blocks that you've built. In this case, you must have digitized your supply chain system for the most part. You have to have your digitization at the central medical store level, digitization at the facilities, and most importantly, in Ethiopia, we've digitized a great deal on the regulatory side, which Heron is responsible for. So that work really allowed us to start to begin the journey of traceability, because we already have these digitized systems. If you have your comms, if you've got your legal framework, but you don't have the products in digital format and all you have is paper, there's very little to go on. And the last but not least, in fact, the most important that we love to share, we're happy to share with you, is enforcement and follow-up. So just because everybody gets it, just because even the legal framework is there and you have the products there, when it comes to the operations and execution, it is a very difficult and complicated process that requires a lot of planning, early planning resources, and enforcement, sometimes maybe even being a little tough with all the different actors to make sure that they are in compliant. So we have a slide at the end on this, and so next slide for now. So talking about just zooming into the digitization component. So I mentioned briefly that in a lot of times, a lot of the supply chain activities started at the central medical store level. In Ethiopia, we start at the regulatory level, which EFDA is a custodian and spearheads the overall traceable initiatives of the country. So as I was listening to the different speakers before me, with Carl, Sarup, Nuran, and there are three terms that just kept coming. So product master data, master facility lists, and supplier registries. So what we've done in Ethiopia is basically that. So we started with digitizing what we call the I-license, which essentially is your supplier registration or registrar. So the I-license is what we use to provide certificates of competence, for importers and manufacturers and so on. And we're doing a lot of work. This is not just a simple form. I should share that these are forms that these are applications that have a lot of validation. We're also currently working on linking it with the Ministry of Trade. So we have active licensing that we can verify using API. So as you couple and strengthen these systems to really be a trusted source of truth, then your entire system works out. I think this is a little bit of, as we learn more on the SMART guidelines, this is a little bit of what Carl mentioned earlier on the foundations being there that would allow the functional pieces that we build on top of it work in a way they should. So we really want to stress that. So it's not just, some Excel spreadsheet, but there's a lot of process there. So the other one that we have is iRegister. Basically, this is a market authorization process where manufacturers or those people who have licenses get to register medicine. Here's where we get our product master data, or I believe the beginnings of the master data. And then Ethiopia is slightly unique. Manufacturers are expected to inform the government before they import anything, even though they've registered it, so that we have information on import permits, which gives yet another visibility into what's coming into the country. We also have a system called iClearance, which is evolving, so to say. So there's a lot of work that's already done with EFDA, but there are other actors like the customs agency, the importers that bring it, that gives us information as to what's coming into the country. And then last but not least, we have a system called iVerify, based on the information we capture at the products I just mentioned at the top. Allows the public, simple app that we have on Google Play, the public can go and scan and able to verify who's registered, who's the official manufacturer, when it was imported, and so on. And as the data that we get continues to grow richer, then we're able to pass on that information to the public as well. Next slide. So now moving still within digitization, but focused on supply chain, we've got digitization across the central medical store, which moves a great deal amount of volume, about $900 million worth of commodities, as well as real-time data we're capturing on the 19 different regional warehouses that we have throughout the different parts of the geography of the country. When it comes to facilities, we also have a system called Dagu that we use for inventory management and daily transaction management. We also have a mobile app that we call Embrana that we use for inventory management and so on, for vaccines for the most part, but a little bit on malaria as well. So these two components, the regulatory piece that I described on the previous slide, as well as the supply chain side, encompass a great deal of the digitization that has already happened in the country and continues to be developed. Next slide. So I won't go in detail on this, but just to give you a visualization of the whole process. So on the left side, you see the regulatory information pieces. On the right side, you've got the supply chain information. So the licensing, import permits, pre-shipments, port clearance. These are all digitized. Some are a lot more mature than others. Others require to be built even further. And then, so this is what it looks like. And then at the bottom, we have a data. I don't like to use the word data warehouse, but we actually have a huge amount of data over a space of 10 years, 10 plus years, where we've collected detailed transaction information on products and inventory management system that we use for data visualization, but we like to dig further into to do much more in-depth analysis. Next slide. So I want to spend a little bit of time looking at this. So the products that we described to you on the previous screen is kind of focused on the digitization, but this is sort of the flow, the traceable flow of how the product flow of how things work in the country. So you got licensure, you got registration, and then you have the procurer. You see at the bottom left, sort of the green icon. It could be a manufacturer or the buyer looking into the national product catalog to be able to import or to be able to register, and then the process of import permit. We mentioned that. The pre-shipment is where they provide us information on what product details are coming, and then later down the road, where the product when it physically arrives at the port level, where the data reconciliation is done. So the biggest piece in all this, and very happy to hear the importance of the master product catalog being repeatedly mentioned, is without the MPC, without the product master data, being accurate and complete and trusted and used by all the different actors, being at the center, basically at the heartbeat of everything, your whole system will collapse. And that is the most important lessons from Ethiopia. And that is work that is not an overnight thing. It requires a lot of support, a lot of patience and years and of effort. And that's something that we've done, but something that we have to continue to work on and build as we go. Next slide. So here's our last slide. And again, this is lessons learned from the country in terms of what we've experienced. So as I mentioned, just to recap a little bit, we've done an amazing job, I believe, on the comp side. I think Ethiopia is one of the first countries to have the legal framework in place. We have a lot of digitization already in place. Again, that needs to be evolved and mature, and nothing stops. It just continues development that we have there. When it comes to implementation operations, our experience has been is that you need to have a great deal and a lot of thinking go into the onboarding strategy when it comes to having this executed by the different stakeholders. So just because you build it, they're not going to come. On the next point, you should anticipate a great deal of handholding, clarification assistance from the suppliers and manufacturers on how to comply with this. And we have a great deal of experience, a lot of pushbacks. Sometimes people give you essentially what's not, it's not accurate data, let's not call it fake data, but like just send something just because they want to comply. And so it's not as simple as announcing something and like hoping that it will come. In our case, we ended up having to have a lot of discussion with the manufacturers when they were not as willing, when they didn't understand. We had to have people available to help answer, but that requires a lot of resources. And we also work closely on GS1, helping clarify some of these, what the really good framework means, how data should be shared, and so on. And I think the discussions earlier, especially on, I believe, on smart guidelines, on interoperability, on how data is shared, there's a lot to be unpacked there. There's a lot to be designed in terms of process and guidance on how the different stakeholders can be in compliance. In terms of deadlines, we were a bit tactical, focused on, say, pharmaceuticals, or this phase first and that phase next. If you try to do all in one, I mean, I know this is a very general rule for everything, it just collapses, especially on the first round. There's a whole lot of challenges. And then sometimes you may have to go back and revise some of your guidance yourself and make some changes. So the phased approach is something that we have learned. So second to last, issue surrounding product identification, attributes, package size. This is a whole piece that it needs to be carefully designed, understood, and in terms of, and weighed in terms of what value do I get for asking for this extra attribute versus if I didn't, but I end up getting the information from these limited number of say item details. Those are the type of decisions that need to be made very early and from a very realistic lens, because it's easy to ask for the world, and then the pushbacks, the challenges, the back and forth and clarification will take just as much time and effort. So that needs to be factored in, as we mentioned on the very top, on the onboarding strategy with careful deliberations. Last but not least, I think the Ethiopian Food and Drug Administration is well respected and known for this in terms of having very strict enforcement and committed leadership, and make sure that, at the end of the day, you provide the policy guidance, the systems in place, but, without strict enforcement and leadership, that does not work. So in Ethiopia, I very much believe that we've been able to accomplish that, working closely with the partners, but at the same time, but being very direct and, demanding that, things are in compliance. over to you. And done.
Thank you. Thank you, Al, for your presentation, and congratulations to the Ethiopian Food and Drug Authority. I have just a quick question to Dr. Heran. It's about, can you please just talk a little bit about this better visibility, how the better visibility prevented falsified product to enter the supply chain? In 2 words, please. Thank you. Over. Dr. Heran, you are muted if you are talking.
Thank you very much. Thank you all for the presentation. I think for Ethiopian Food and Drug Authority, the basic objective of traceability and visibility is to secure the supply chain in terms of substandard and falsified medicines. There are a lot of regulatory functions that we do, regulatory work that we do, and we base our work on the strategies that are identified globally and also based on the guidelines of WHO, that is detection and response. So what we do majorly is on the prevention side, because that's the major strategies that we have in terms of securing the supply chain and safeguarding the health of the public. So as you know, we are in a geographically located in a region where these kind of problems are very much prevailing, because in the sub-Saharan Africa, because of our porous borders and because of in terms of strength of regulatory works as well, regulatory system, there are a lot of gaps that we identify. So we need to be very vigilant in terms of substandard and falsified medicine. So we have been working on traceability strategy, and as Al was presenting, we were doing a lot of communication, a lot of digital works as well. As he has indicated, we have electronic regulatory information system where we do all our regulatory functions in an automated way. And we have also the registered medicine list. Now, what we need to do is to really fulfill all the requirements and really trace the products from the manufacturer to the retail. We have done a lot of quick win works in terms of, because we have, apart from the different modules that are there in the ERI, in the electronic regulatory information system, we have developed an iVerify system, which is a mobile application to identify whether products are legal or not in the retail pharmacies. So we have to do a lot, but the basic, the foundation has been done. But in terms of full traceability, you know that there is a huge work to be done. The master data and all the issues that is needed, and also in terms of adapting the GS1 standards. Also, there are a lot of things to be done. But this is very, very, very important. And also we have seen this in the COVID era also, that because of the interruption of the supply chain, we were challenged in terms of substandard products. So I think for us, it's a basic issue. And in terms of from the prevention side, and even from the detection side also, if we equip the professionals, the public, on how they can detect this kind of products, and it will be also very easy to respond, to take action, to take enforcement action on this kind of product. So we see it from the supply chain security and in terms of ensuring public health. Thank you very much. Over to you, Doc.
Very much, and congratulations again to the Ethiopia Food and Drug Authority. Now, next slide to Zambia, to Mr. Mwale. or Lukonde. Over to you.
Yeah, thank you so much. My name is Lukonde Peter. I will share a presentation on behalf of Zambia. I know that on this call, I have colleagues from Global Health Supply Chain, including colleagues from the ministry. Yeah, so I think maybe before I go into the presentation, let me just apologize that we are in the field, we are doing the drug assessment destination checks. So right now, as I'm making the presentation, I'm in the car. I would have loved to be presenting with the video on, but maybe I would ask that you allow me to just present the way it is, if it is okay with you. Thank you so much. Yeah, so with that said, let me begin by just thanking the organizers of this summit, the previous speakers, as well as everyone on the call. I think I've been following the very insightful discussions from my previous speakers. So now just allow me now just to give the Zambian perspective with regards to the GS1 implementation in Zambia. You can give me the first slide. Thank you. Yeah, so what you see, team, is what I can call the traceability implementation journey for Zambia. But before I speak to this, allow me just to maybe just briefly talk about the supply chain landscape in Zambia, so that when I start referring to this slide, maybe it will be easier for everyone to follow. So if you look at Zambia, we have the Ministry of Health, and then we also have the regulator, which is Zambia Medicines Regulatory Authority. This one, that's the one that regulates all importation, exportation, distribution, labeling of medicines countrywide. They draw their powers from an act of parliament, the Medicines Allied Substances Act of 2013. Then we also have, on the other side, we have ZAMSA, Zambia Medicines and Medical Supplies Agency, which also draws powers from the ZAMSA Act number 9 of 2019, which mandates it to store medicines, all the medicines for public health facilities, to procure as well as to distribute. While the Ministry of Health, working with other partners, we provide policy frameworks. So with that said, allow me also to mention that the supply chain in Zambia is guided by a number of documents, some policies, as well as the laws, just like I've alluded to. So even the Zambia traceability implementation did not exist, does not exist in vacuum, but guided by the policy frameworks. So for those of you who have gone through some of our policy documents, you will agree with me that the vision for the Zambia pharmaceutical traceability was governed by the National Health Strategic Plan 2019-2020, 2021, which provided a strategic framework to promote effective and efficient delivery of health towards Zambian using ICTs. Yeah, so drawing that in 2019, now we begin now following the slide. So now in 2019, guided by that framework, the Ministry of Health called for a workshop with various stakeholders within the supply chain, which for this workshop is what actually culminated now into the launch of the Pharmaceutical Traceability Initiative. It is as a result of this workshop, that's where the team defined the vision, the team defined the roadmap, as well as the end-to-end visibility in Zambia through the use of global standards. So, and then when you move to the second one in 2021, the next thing that was done was that ZAMRA, which is Zambia Medicines Regulatory Authority, began drafting the regulations for the GS1 based on identification as well as labeling and drawing powers from their act. And you can see that within the same year in 2021, the government began standardizing the product identification protocols, as well as implementing a scalable and sustainable product master and data program. You appreciate this, I think, as we start getting down. In 2022, the Ministry of Health partnered with the GS1 South Africa to integrate our national product catalog 2 with the global data synchronization network to also the source master data. And for this, we managed to do this with 2 products. We began with the ARV as well as the antimalarials. And in the same year, if you see the last part, which is 2022, the country began to explore opportunities for GS1 barcoding at our central warehouse at ZAMSA. So you will see from the next slide, you will see that most of the things that I'll be talking about are guided by some of the things that we are able to do. So I must mention that Zambia, we managed to develop the pharmaceutical traceability strategy, and we had the 4 objectives in that strategy. The first objective is addressing governance, and our objective there is to establish a governance structure to lead the strategy, collaboration, outreach, and oversight of global standards and traceability implementation. Our second objective is to strengthen the regulatory environment to include legal frameworks that enable traceability of medicines and medical supplies. So this is what was being addressed by our regulatory body. And then we have the third one being to evaluate, build, and sustain technology to support interoperability of public sector health systems in a bid to improve data visibility. And our last objective in our strategy is to create efficiencies in the public health supply chain through standardized identification and automated data capture. So you will see that my follow-up slides will be speaking to some of the activities that as a country we've been able to achieve under each of these objectives. Thank you. Next slide. Yeah, so under regulations, like I've already alluded to, ZAMRA draws its power from the Medicines and Allied Substances Act number 3 of 2013. It's the one that gives the Zambia Medicine Regulatory Authority the mandate to enforce a suitable coding systems for all medicines and allied substances meant for the Zambian market. So, they started working on the development of the regulations as well as the guidelines. I must be quick to mention that as a country, we are happy to report that we now have the approved guidelines The guidelines took some time because I think we never had the board in place. But now that we have the board in place, they sat and the guidelines were approved. And we are yet to publish these guidelines maybe in the next one month or so. We can move. So this is one of the achievements that we have under regulations. Next slide. Then now coming to the National Product Catalog, this is the one now that is housed at the Ministry of Health under the ICT department. And so far, if you look what we have been able to do as a country is that we have been able to integrate the National Product Catalog to the manufacturer through the Global Data Synchronization Network. And this was done with assistance from the South Africa GS1. So you can see that in terms of its ability, it's able to integrate with Global Data Synchronization Network for product data source direct from the manufacturer. And it has the ability also to share with other systems downstream. So you can see that as of now, we have been able to, in country, able to integrate with our WMS expert system, which is based at our central warehouse at ZAMSA. And then we are yet now to integrate it with the IRIM. So IRIM is just the system that is used by our regulatory authority, which is ZAMRA. And then we also are in the process of integrating with other management information system within the country. We can move to the next slide. Yeah, thank you. So we thought that we could also share some of the National Product Catalog accomplishments. One of them we address is on data, the other one is covering technology, and the last one is the process and the people. So you can see that under data, more than 4,000 products, pharmaceuticals have been harmonized. We have had 551 global trade items collected and paired with volumetric data, GTINs mapped under ZAMSA, Ministry of Health, as well as the ZAMRA. And then we have an ongoing data harmonization as well as cleaning processes. And then under technology, the National Product Catalog systems implemented using the product management tool, which I think I've spoken to. And then the product management, the PCMT, this one is being hosted at Ministry of Health, ICT. And then we have the National Product Catalog integration with the Global Data Synchronization, South African, as well as other systems. So those are some of the things, achievements under technology. And then under people, there was a training which was conducted for data stewards from the Ministry of Health, the Zambia Medicines and Medical Supplies Agency, as well as our regulatory authority, ZAMRA. The other thing that has been done under process and people is a comprehensive SOP developed for product master data management processes. I should be quick to say regulation issued or approved, which would drive the GTIN data collection directly from manufacturer. The other one is the onboarded catalog manager. We can move to the next slide. Yeah, thank you so much. So again, here we just want to show you that some of the steps that we did under global GDSN pilot. Here, like I said, we managed to connect our product catalog, national product catalog, direct to the manufacturer through the South African global data synchronization network. You could see that where there are dots in the first phase, this has been a manual process. Yeah, but if you see that starting with the third phase,
Petros, we seem to have lost you.
hello.
Yes, you're back now.
Thank you so
Yes.
much. So where did I?
Please, just you are back, but we have roughly 3-4 minutes. Please try to
be quick.
Yes, thank you.
Thank you so much. So I think this slide I've already spoken to it. We did some pilot within the manual integration, and now we want to go to the automated integration. Next slide. So global data synchronization, this one is also just is speaking to what I've already alluded to. Global location numbers have been obtained through our colleagues in South Africa, been able to set up a process to receive and upload the GTIN data from suppliers. Architectures and data structures have been aligned. We've been able to identify, 13 suppliers, and then also under phase 2, the WMS expert has been configured. This I spoke to. We've been able to define attributes that are required in the extract with a focus of supporting automation. The last one there is we've been able to establish a process to export as well as extract items. Next slide. So now ZAMSA, it being one of our key player responsible for procurement, storage and distribution, considering their mandate. Currently, they've been working on developing systems that should be interoperable with each other. And then ZAMSA currently has been uses the internal barcodes for bin flow location to facilitate putaways, picking, and other issues. Next slide. Yeah, so if you look at this, if you look at this slide, you will see that, the first column there is just looking at the WMS data not being configured to support the concept of each is parent, and most of these processes are being done manually. But where we intend to move during our transformation is we define attributes such as the volumetric sources direct from the global data synchronization, and so that most of these processes should be automated. Next slide. Yeah, so now what are some of the lessons learned, or rather successes, as I conclude? Is just to mention that as a country, I think we are proud that under leadership, the Ministry of Health, working with other partners, the minister has been leading these processes, and I think we celebrate the enormous support that we are receiving from our cooperating partners, not to mention a few. And then also under governance, we managed to develop through the permanent secretary appointed the TWG, and later through that TWG, we've been able to also form subcommittees, others addressing regulations, others addressing supply chain operations, others addressing data management. So I think with that, we've been able to develop terms of reference. Under regulation now, we have the regulations and guidelines. And then under the results there, the last one is that we've been able to, to define, architectures as well as align them in a bid to align them to the global standards. I don't know if there's another slide. Yeah, just to thank you everyone for listening. Thank you.
Thank you, Lukonde. Angela, Noran, how many minutes do we have for Q&As?
5, Da, sorry, 5.
5, okay. There is a question from Maximilien about what is the difference between the two inventory management system in Ethiopia, and what is the purpose of having two inventory systems? This is to you, Al.
Sure. So the question is a bit, there's actually there's only I guess there are two. One is at the central medical store and the different regional warehouses. So it's a much larger ERP level system. And then the other inventory management system that I discussed is at the facility level. So it's much smaller, tailored for hospitals and health centers.